As a way to improve health equity, will CDC include disability prevalence as a key demographic indicator in our reports? And I'll direct that to Dr. Brooks first.
Right. Well, thanks for that question. Disability is a prevalent issue in our country, and it's one that we take very seriously at our agency. We have a large effort committed to assisting people with disabilities and to navigate public health system and our regulations and recommendations. I think one of the difficulties with putting a figure on disability is knowing the number of persons who are disabled that we can track in real time. I'd be interested in what Matt Ritchie thinks about this, but we're often asked about a variety of different factors. Why aren't you tracking them? And it sometimes is very hard to nail down the data source that provides sufficiently reliable information to use that in a way that could inform a recommendation. That doesn't mean that we don't ignore the problem. On the contrary, specifically with some forms of disability, like immunocompromise, we go to great efforts to ensure that what we're talking about and how it relates to persons with immunocompromise, which in the case of a respiratory infection is critical, is directed at those audiences. And likewise, when persons with other disabilities have difficulties with other types of our recommendations, how to wear a mask in a person who is unable to breathe because of a respiratory tract issue, breathe as an other person would due to a respiratory issue, or who have difficulty managing other aspects of our recommendations. We try to amend them. We also really rely on the feedback from the disability community. We regularly speak both with members of the community as well as groups that represent them and folks who care for them to ensure that our recommendations are meeting their needs. And where we're not meeting their needs, we want to hear about it so that we can do that.
Captain Ritchie, did you have anything to add?
Not too much to add. Dr. Brooks, I think, captured a lot of it. It does go back to, as we think about from a data perspective, kind of identifying the population affected by disabilities. And that's a difficult thing because there's a lot of different definitions around that can be used. Some that are administrative based, others that are kind of more based on kind of certain contexts and that sort of thing. So within our data streams, and I've been a part of a lot of this work because it is central to what we want to do as we talk about health equity, is to be able to identify those populations and seeing if they have an unequal burden of COVID disease and poor health outcomes. So definitely a high priority to us. There is some difficulty though within our data about effectively identifying those populations.
And I just want to also add to what Matt just said, which we don't want to give the impression that this is impossible. I think I look forward to a future where we're able to capture this. And I will offer as an example what now may seem hard to imagine, but for a long time, we didn't capture race and ethnicity information around testing. Well, it turns out that, when you turn in a lab slip for testing, it doesn't routinely ask you to record as a provider, let's say, what that person's race ethnicity is, or for the laboratory to record and report that. But through concerted efforts, we found ways to help get those data streams and information into place to capture the information. And we might be able to look forward to similar efforts like that in the future.